Okay, we're having a discussion today on fluoride in dentistry and fluoride supplementation and what and why and how and what's going on with that right now. And fluoride supplementation and has been around for a long time. It's been considered to be one of the one of the greatest happenings in public medicine. Something that's really been helpful to the public in reducing decay for well-known reasons, but still there are those that uh, can disagree with the mechanism for its being done, the fluoride supplementation. So is there a reason for the controversy? I am a dentist. I do have a position in a community dentistry program, but I'm not a public health professional. I actually am a general dentist who teaches prosthetics at the University of Florida, go Gators, for those of you who are basketball fans. And from a standpoint of dental decay, uh, there the children can have a mouthful of decay. I mean, just terrible decay. But so how does fluoride help against the decay? And what are the different mechanisms in decay for children, for adults, with medically compromised people? I mean, why would you want fluoride supplementation? And we're gonna discuss that today. And fluoride is, it's a mineral. It's found in all natural water sources. The ionic form of the trace element fluorine, which is commonly found in the environment. Fluorine reaches water sources by leaching from soil and rocks into the groundwater. So how did we discover that fluoride could be beneficial to teeth? I mean, it's long been established through recognized studies that when used as directed, or within the context of community water fluoridation programs in the correct dosage, that it's safe and effective agent that can prevent and control caries. Now, fluoride in the dental environment comes in many different formats. We're talking about supplementation right now, which is dietary, systemic, but there's also fluoride that are topical, toothpaste, and other products that one can use at home, and also in the dental office and by prescription. There's different levels of fluoride. But however, when we're talking about community water systems, realize it does impact all those who consume the water, which can be an affront to personal choice. So are these local issues? Now, if there are mandates or laws to fluoridate water systems, is that fair to the entire public? And what about statewide laws that do not allow fluoridation when some municipalities would be in favor? So let's talk about this background and considerations to better understand the issues. And if you think about a tooth, and I'd like you all to envision your teeth, you smile and look at your teeth and brush and take good care of them every day, and realize that that outer shell of your tooth is mostly mineral. There's very little organic component in the enamel. It's very strong, or should be very strong. That doesn't mean that it can't get decayed. Decay comes in different forms of decay. It's not always a black hole on the side of the tooth. It can be on the top of the tooth. There's different mechanisms for that. But when decay penetrates through that enamel and gets into the underlying dentin, which is the next layer, which is still a very calcified layer, but a much more organic component, then it's almost like Swiss cheese. It has tubules or spaces in the Swiss cheese that go down to the dental nerve or pulp inside the root of the tooth. And you get a cavity that goes through the enamel and starts to get in the dent. That's when you start to get your early warning system. You start to feel the exchanges that come through those tubules. And if it gets bad enough and gets into the pulp or the center of the tooth, then you can get a necrotic pulp. And then you have a toothache, a flaming toothache that hurts all the time. We know in children how much pain can be an issue for them in terms of failure to thrive. So cosmetics are an emotional issue, obviously, but there's also pain involved. And how do you study when you're in pain and you're a child that's 4 or 5 years old? In today's day and environment, especially on lower socioeconomics, the chances are, if you're having a diet where you can't afford a lot of fresh fruits and vegetables, where that's just not the habit in your household, and you're having a very sugar-laden diet, that you're going to get a lot more decay. I'm going to pause for just a moment and N5-RTF Chip, if you can just take a second as a psychiatrist and tell us a little bit about your perspective of how you think that emotionally might affect children to have a smile that was very cosmetically displeasing and also to be in pain. I'm going to turn that over to you, Chip. This is N5-RTF coming to the mic. WB5D, turn the mic over to Chip.
Okay, I've got a thunderstorm warning going off in the background. Give me 1 second to turn it off.
Chip is in the New Orleans area and had a lot of thunderstorms. Go ahead, Chip.
Uh, yeah, I mean, children are naturally cruel to each other. They don't have a lot of sensitivity and they have yet to develop empathy. So if they see anybody that's different in any way, they'll often pick at them as a group. I remember a friend that I had in elementary school. He had had his teeth damaged by tetracycline. Um, that doesn't happen anymore because people know about it. But he was one of the first people to take tetracycline as a small child, and I think it prevented the enamel from forming. So he had basically yellow teeth, and it was very traumatic for him because every time he tried to smile, everybody would stare at him. Very uncomfortable situation. Um, Even with adults, you can imagine going in for a job interview with missing teeth. It's going to cause problems just about anywhere you go. The other thing that I noticed as a physician, as a psychiatrist, was you mentioned failure to thrive in children, but there's failure to thrive in older people too. As you lose teeth, you lose the ability to chew, and you stop eating steaks, and you start eating, softer and softer foods, which generally are less healthy for you, and you can end up very easily in a nutritional death spiral. And I've seen that happen many times, even to family members. This is N5-RTF.
Thank you, Chip. N5-RTF, Whiskey Bravo 5 Delta, AA4 FL. Mike, you made some very important points here, and they actually intersect well with the material today, Chip, beyond just the psychiatric and emotional outlook here. When we talk about tetracycline staining, it actually has a lot of correlation to fluoride and fluorosis. So we're talking about disorders that have to do with development of the teeth. And if you think about ear infections during the time when you're 2 and 3 years old, and years ago they would give tetracycline quite often for ear infections, for other infections. And what happens when you're 2 and 3 years old? Well, you have your children's teeth, your baby teeth, but your permanent teeth are developing. So as you take these doses of tetracycline, it's putting out layers of incorporated tetracycline that's affected the development of the teeth. So when you're 6 years old and your 2 front teeth come in, you've got these rows of stain that are going to be with your whole life. So how did we discover fluoride was helpful to fight dental decay? There's quite a history to this that actually, goes back to the early 1900s. And we'll talk about enamel itself and the way that it incorporates, and we'll move on to talk about the development of fluorosis and how teeth are affected by fluoride. But dental enamel is the most highly mineralized tissue in the human body. It's got great mechanical properties because it combines extreme hardness and stiffness with exceptional resilience. So it enables it to withstand hundreds of chewing cycles with biting forces that are very extreme in the harsh environment of the oral cavity, which also undergoes extreme pH and temperature fluctuations within the human body. Think about a tooth. Teeth are actually in the body and outside of the body. The roots are rooted inside the bone, yet the enamel is in the oral environment, was exposed to the air. Think about the stress levels, the mechanical thing. We're really good as ham radio operators of thinking about things in engineering terms. Well, think about a tooth in engineering terms. How do you design something that's going to handle millions of chewing cycles and hundreds every day, of course, with extreme forces, and not break or not have biological failure. So it covers the tooth of crowns in humans and all tetrapods that have enamel-like coatings that appeared 500 million years ago and been constantly evolving. So what is it composed of? It's a hard mineral, hydroxyapatite. And that apatite is packed at a high density. It's rods of calcified crystals. And there's many other biomaterials. It's got to be space filled to withstand the forces. So it's got a hierarchical nanocomposite material with intricate organizations, the key to its mechanical performance. It's building blocks. Think about building blocks. We're going to build something for strength. In this case, it's the enamel rod, an array of aligned, carbonated apatite crystals, which are thought to be orientated in their C-axis along the rod axis. Not to get into tooth development to too much of a degree, just to give you an idea of the mechanics and why we want that enamel to be strong. And what about fluoridation? We're going to go back in just a minute, but I'm going to pause here. This is a forum, an interactive forum. Is there anybody that would like to make comments or ask a question at this point? Make your call to Whiskey Bravo 5 Delta. Okay, now this is Whiskey Bravo 5 Delta, the Medical Amateur Radio Council for ID, AA4F Alpha Mike, operating out of Hawthorne, Florida today. Are there any other check-ins? We encourage all amateurs to check in and be part of this interactive forum. Okay, no further check-ins at this time. So fluoridation, I mean, where did this all come from? I mean, where does the research come from? Where did the problem first get noticed? We just talked about, similar to tetracycline staining, something called fluorosis. Well, a dentist moved from the East Coast to Colorado Springs, Colorado. When he arrived, he was astounded to find so many of the natives there with grotesque brown stains on their teeth. It's so severe that they could be permanent. But those teeth did not have dental decay. So if you're not at the rate that one would expect, they were hard but defective. So this was excessive fluoride, not known at the time what the cause was, getting into the tooth structure, causing something called fluorosis. So fluorosis is a potential issue if there's not the correct amount of fluoride in water or in the diet. And wells in 10% of American households, well water has adequate fluoride already. In this particular case, in this particular community, it exceeded what would be normal. So fluoride coming from fluorine, whether you supplement it in the community water system, I mean, one of the arguments against fluoride supplementation is that it was being used because it was an industrial waste material. They needed to find some use for it. You know, you got to be careful when you hear things on the internet. You can go research the subject, but keep an open mind and be balanced. Don't pull everything from one source, because that's a comment that obviously in this case can be negated through long-term studies. And while it may be an emotional pitch issue, it doesn't mean that it relates to reality. My son's a philosophy professor, teaches at Central Florida College in Ocala, Florida. And part of what he teaches his students when he's teaching logic is syllogisms and philosophical concepts and arguments. And just because something is said in an argument form doesn't make it a true argument. It may not have a true premise. It may have a primary premise, secondary premises, and come to a conclusion. But you still have to truth test that. Be logical when you're evaluating what you see online. So right now, Utah has just recently enabled the legislature to put a ban into law, nationwide first for a state, that there'd be no water fluoridation in public water systems. And that law prohibits fluoridation to public water systems. However, it would allow pharmacists to prescribe fluoride tablets for those needing fluoride as an alternative method and those wishing to take fluoride. We'll talk about that, not the Utah situation, but that last comment and whether or not that can be truth tested, that comment, whether or not pharmacists can prescribe fluoride. Remember how I said that 10% of municipal of wells in the United States, approximately from the statistics that I saw, have adequate fluoride in it. I mean, what's adequate fluoride? When I say adequate fluoride to protect against decay, the amount that we fluoridate water, 0.7 parts per million. I mean, that's a complicated formula. What if you're in a hot environment, we drink more water? There's a safety zone, so you don't get fluorosis. Now, here in Hawthorne, Florida, where I am, I actually tested well water for patients because we did have a small community of 1,500 people, 20,000 in the surrounding area. And because of that, even though the water had been fluoridated in Hawthorne, Florida, I wanted others, if they desired, to be able to have fluoride supplementation. So what's the first thing I did before prescribing fluoride tablets? I would get a sample of their water and run a test to see how much fluoride was already naturally occurring. And believe it or not, my little area of Florida, we did have wells that had adequate amounts of fluoride in it. What if I was the pharmacist and gave them a prescription for fluorine tablets without testing the water? They could potentially have brown stains in their teeth or fluorosis. It would have been a cosmetic issue, not a functional issue, but giving a 4-year-old the supplementation while their teeth are developing, same thing like tetracycline staining would have occurred by the time those incisors came in. And we think the incisors, they're right in the front there. We think of that as the cosmetic zone. And obviously that would not be a very favorable thing to do. And true enough, in practice here, I did see some mild fluorosis. So there were members of the community that mildly had that issue. So let me pause one here for any questions.
Jay,
comments. Go ahead, Chip.
what about bottled water? If you buy bottled water in a store, does it have fluoride?
Generally not. That's a question from N5RTF on whether or not bottled water has fluoride in it. And we'll go over some of that too, Chip, because it's not just the bottled water that's an issue. It could be filtering systems, reverse osmosis. There's other ways that fluoride is taken out of the water. Yeah. So it's a very, very pertinent question. Thank you for asking it. Any other further questions? Make your call to WB5D.
Whiskey Romeo 8 Bravo Tango.
Okay, Whiskey Romeo 8 Bravo Tango. Go ahead.
Yeah, I live in rural areas that get well water, so I don't have fluoride introduced into my water. But a dentist recommended to me that after brushing my teeth to not rinse the toothpaste out of your mouth, but to just put out the toothpaste and then leave the rest in there and use that sort of as a fluoride treatment.
Well, that's a very good and important comment. Thank you for making it. I can understand that recommendation. As dentists, of course, we obviously don't want to consume our toothpaste for sure, but I don't think leaving it on the tooth would have you ingesting it. There's a different method to fluoride on the surface of a tooth, and so it's very important that you brought that up. And we are going to talk about that here today in a lot more detail, Bob. And I hope that will answer your question as we have further discussion here on the forum. And if not, we'll certainly entertain that in more detail with follow-up questions. So, Bob, in making and asking that question, it's very important in noting that whenever we have a thread of discussion, no matter what the subject is, questions expand the thread. It's a new thread. And everybody's comments from all amateur radio operators are extremely important. We need to hear from those of you that are listening. So knowing that, we'd appreciate you checking in. Make your call to Whiskey Bravo 5 Delta so we can get you checked in. And no further check-ins at this time. And as we talk about those bans, Bob, and we're talking about the ingesting of fluoride that's coming in through the water supply. So you said you're in a rural area. You're assuming you don't have any fluoride in your water. Not that that would have anything to do with the recommendation that I would make as a dentist in terms of brushing your teeth and keeping on the surface teeth, because that is a whole different mechanism of protection. But when we're ingesting the fluoride in the water, the benefit is it gets incorporated into developing tooth structure. Like I said, if there's too much, you'll get brown spots. But if you hit the sweet spot and get just the right amount, that crystalline structure has fluoride incorporated into the hydroxyapatite, and the fluoroapatite is a lot less likely to dissolve. So it'll be through and through the tooth. Now, it's true that you may get a little in your saliva from what you ingest. So, but it's really more for children, maybe through the age of, I don't know, 18. If you think about developing teeth, because we still have wisdom teeth developing, they come in when we're 18 or 19. So, I would say from about 6 months to 18 years, the ingesting would be, or having water supplementation or tablets would be of the greatest benefit during that time. In Florida here now, they're going the same way. And so I believe what you discussed, Bob, that was a great question, WR8BT. We appreciate that, because here in Florida, I think I saw the governor on television making a comment about fluoride supplementation, that we're going to be looking at that because there's better ways to get people fluoride. And I think he used the instance of you, Bob, where you're brushing the fluoride toothpaste on a tooth, and that would be protecting teeth. That's two totally different things. They're not related to each other, and that's a faulty syllogism. So we need to better educate the public and discuss these options so you can make an informative decision, people balance on all the information that's best out there. And of course, you got to balance individual choice. And that's one of the problems with community fluoridation. You don't have individual choice. Now, you may have community choice. You certainly can work with your local municipality to choose to fluoridate your water and have meetings and discussions. But if a state bans water fluoridation, then the municipality is denied the chance to have personal choice. So that's the other side of the coin there. So we have new questions that emerged in 1901. I mean, they were observing this fluorosis, but did they really know? They didn't know why. They had to research that. They started looking at the epidemiology of fluorosis in 1931 at the National Institutes of Health, and they discovered what the cause was, and that was the level of fluoride. So next they had to have proof that fluoride prevents cavities, and take it into the public domain. So the city of Grand Rapids, Michigan in 1945 became the first city in the world to have its public water supply fluoridated. And the first city in the world fluoridated its drinking water. And what happened? It was originally, the study was originally sponsored by the US Surgeon General, but taken over by the National Institute of Dental Health shortly afterwards, inception in 1948. So during this 15-year project, researchers monitored the rate of tooth decay among Grand Rapids' almost 30,000 school children, and just after 11 years, they announced an amazing finding. The rate of decay among Grand Rapids children born after fluoride was added to the water supply dropped more than 60%. And that finding, considering there were thousands of participants in the study, amounts to a great scientific breakthrough that promised to revolutionize dental care, making tooth decay for the first time in history a preventable disease for most people. So I'm going to pause for a second and talk about the other side of that coin. One of the other arguments that disease is caused by too much fluoride. So let's look for any additional check-ins. If you're finding this to be a fascinating conversation or interactive discussion on our net, we certainly want you to participate in the roundtable. Make your call to Whiskey Bravo 5 Delta to check in and then to ask questions. Make your call at this time. Okay, no further check-ins or questions at this time. We'll continue on. So what about the argument that certain diseases might be caused by too much fluoride in the water? I mean, how can you refute that? Well, remember, we talked about 10% of people in the United States having water in their area that was already fluoridated at the correct levels or had fluoride in their water. Well, wouldn't you see the diseases then in those individuals? So why would you expect the fluoridation to cause disease if it didn't cause it in those individuals? That kind of negates that argument. Think about that in logical terms and what that might mean if you run into that comment on the internet. Now, in 2020, is where it was discussed. There was a particular article released. You can look it up. It came out through Water Resources Mission Area, California Water Science Center, also by the Colorado Water Science Center and the New England Water Science Center, as well as the Pennsylvania Water Science Center. If you want to look this up on the internet, the authors are McMahon, Brown, Johnson, Billets, and Lindsay. And what they came from data with 38,000 wells used to characterize fluoride occurrence in the United States for domestic wells, generally not purposely fluoridated or monitored for quality. 10.9% of the samples had fluoride concentrations greater than 0.7 ppm. Well, of course, that says greater than, so it's not true that their optimal level, the optimal level is 0.7, but this particular study said at least 0.7. So some of those wells could have excessive amounts of fluoride in them as well. And I hope you'll get a chance to look up that if you find an interest in that particular subject. Because again, fluoride is a mineral found in all natural water sources, being the ionic form of the trace element fluorine, commonly found in groundwater. And now you know how we discovered fluoride could be beneficial to health. But if you want to look up that particular article I was mentioning, you can go to look up fluoride, the story of fluoridation. It's actually an NIDCR, NIH.gov article. But if you just do the story of fluoridation and you see the government article under health info, you'll realize that's the study that I'm quoting here from. So it's been long established through these recognized studies that when used as directed within the context of community water fluoridation program and the correct dosage, water is safe and effective agent that can be used to prevent and control dental caries. Now, what about the argument that people are worried about getting too much fluoride and that could cause some negative effect to the body other than teeth? And we just talked about disease. Are there other entities that we consume that cause problems or cause disease? For those of you that, and I don't know how much water one would have to drink for water to be fatal, but I'm sure we can float our body away. I mean, we know that from past discussions we've had here on the Grand Rounds about artificial sweeteners, that if you give rats enough artificial sweeteners, they can develop cancer, certain artificial sweeteners. But we give it in the correct dosage and it has no effect. I don't think there's too many humans that drink 5,000 cans of soda in a day with artificial sweeteners. So once again, you also have to consider the context. Any drug that you take, any medication you take has a therapeutic index. It's safe in certain dosages. For those of you that may not be aware of it, Tylenol is a perfect example of an over-the-counter drug that's given. If you take too much Tylenol, you're going to kill your liver. You've got to take it in the right amount. They've even had to change the dosages of over-the-counter medications and encourage you to be aware that you can only have so much a day because so many different products have Tylenol in it, so many different cold medicines. If you're taking pills of Tylenol, in addition to those cold products, medicine products, you could have a problem. I remember having a patient who was a nurse, who also was a hepatitis patient, and he actually passed away from too much Tylenol because he also had cirrhosis of the liver. He couldn't metabolize the Tylenol. So you can have negative effects, but again, put it in appropriate context. Any questions about the comment? Make your call to Whiskey Bravo 5 Delta. Okay, remember, I have no comments. I'm not a physician. This is not medical advice. This is just us discussing as a group topics that are related to health. If you have a question of a medical nature, talk to your medical team about that. So this is AA4FL, the Mike, Alpha Alpha 4 Foxtrot, London, transmitting out of Hawthorne, Florida, my home station. Our club call is Whiskey Bravo 5 Delta. This is the Medical Amateur Radio Council, Grand Rounds in the Air net that takes place every Sunday at 11 o'clock Eastern. And this is typical of some of the topics that we discuss as a group that we have a forum on, a net on. Our members check in. We're using NetLogger. We have 16 check-ins at this time. And it allows us to take questions. People can submit them by email. We also have a Zoom session running here. We're going to be recording this for a YouTube video. Many of our members are seniors, just like Chip talking about seniors not functioning well when they don't have teeth. Our Marco members that are seniors don't function well when they don't have access to 20 meters. And we want them to thrive. So how do we have it thrive? We do a Zoom simulcast. So our members that are not, that we might say are HF challenged, might live in a community that's deed restricted, that doesn't allow towers, and you may not have a transmitter in your house that can participate through our Zoom simulcast. So thank you for allowing us to have these discussions and involve everyone and make YouTube videos for the public. So how does fluoride help teeth? And you can look up an article called "The Role of Fluoride in Dentistry: A Narrative Review." And if you look up that article, you'll see some charts there. And in those charts, it talks about, and this is getting back to Robert's comments, KR8BT, WR8BT. Bob, there's different ways that fluoride can have an effect on teeth. We're talking about that children ingesting fluoride, which makes that enamel resistant to the acids that are created when you eat food, and a food pellicle forms on your tooth. That food may be incorporated into the surface of your tooth. If it's not removed finally, it can develop to be harder. And there's different surfaces of the teeth. Decay happens in different formats. There's smooth surfaces of the teeth, the ones you see when you smile. And there's the chewing surfaces of the teeth, where food gets caught down in the pits on the top of the teeth. That's called pit and fissure caries. But if you're brushing a fluoride, can you remineralize? We take the surface enamel, hydroxyapatite, and make it less likely to dissolve when it's affronted by or challenged by the acid that's produced by the bacteria that are in your mouth when you eat, particularly after you eat sugar. Well, that's topical or brush on fluorides, can help in remineralizing enamel. So Bob, your dentist had recommended that you brush your teeth and leave it on the surface, spit it out and not rinse afterwards. And that's certainly a valid recommendation. If he was extremely concerned about your risk of decay, he can also give you a prescribed level of fluoride. That's something to discuss with your dentist if you're somebody that's susceptible. Why would we be susceptible as we get older? You know, Chip had mentioned as we lose teeth, we lose function. A lot of seniors are in their 80s and 90s now, and they're on many different medications. That's called polypharmacy. And think about what that means to your salivary flow. Many drugs have a negative effect on the flow of saliva. When the flow of saliva is affected, you lose a lot of protection. Those teeth are not lubricated. That may change the environment, allowing the bacteria to have a greater effect on your teeth. It may change the pH, acidity of your mouth, which could affect also the quality of the topical fluoride to do its activity. It may not work at certain pHs, even though the products promise to be the salvation. Fluoride also has antibacterial effects. It inhibits enzymes essential for growth and metabolism in bacterial cells, lowers the surface energy of the teeth. So brushing the fluoride has other effects as well to the surface of the tooth. It can help to strip the bacteria off that surface hydroxyapatite, but we're hoping to remineralize and becomes fluorapatite. The fluoride ions get incorporated. And if you go to that article, you'll see a lot of chemicals. You'll see the structure of teeth and the way that hydroxyapatite is described chemically, for those of you that have a chemical background, and what happens when fluoride occurs, because naturally occurring mineral form of calcium apatite, or the hardness from teeth, is hydroxyapatite. But when you add fluoride to the mix, you can get fluorapatite. And that fluoride gets incorporated in the ions for calcium that's lost at the surface, making a stronger bond. Well, it bonds to the calcium for a stronger bond, excuse me. So you can look at the chemical nature of that, the scientific nature of it, trying to be a scientist in that realm. This is AA4F Alpha Mike, Whiskey Bravo 5 Delta, the Medical Amateur Radio Council grounds me, or we'll pause for questions at this time. Go ahead and ask. Make your call to WP5D. Okay, so No comments heard at this time, but let's think about this a little bit different. Let's think about our forum with questions. Let's hear your thoughts. So, question, are there options to community water fluoridation that are as effective? You know, are there high-risk populations that would benefit greatly, and from which approach? Do the young and elderly have similar risks? And what segment of the population would find the options affordable? And where does diet fit into the dental decay discussion? You know, what's the difference between smooth surface and pit and fissure caries? Can sugarless chewing gum actually help? So I'm going to start to ask what your questions might be about each particular item there, and then I'll be more than happy to expand upon it. Some of we've already studied. Do we have any questions or comments about options to community water fluoridations, other options that could be as effective? Any questions? Make your call to WB5D. You know, I have a couple of individuals in HF. Your signals are really down. I'm not hearing the questions. KM2M, Dave, if you're still here with us, are you copying questions that I'm not hearing? Go ahead. Yeah, there's some comments being asked or questions I can't hear. I was wondering if you could hear them and relay them. Thank you, SL. Thank you for trying, Dave. And by the way, I do vaguely in the background, my propagation is not great today. I'm sorry. I hear two different questions below my ability to copy them. You know, again, that's the benefit of having the net logger. You can ask those questions and type them to me. You can download net logger online, and as you do, there's an instant message feature. You'll be able to ask those questions. This is Whiskey Bravo 5 Delta. So options to community water fluoridation that are effective. Well, now we're talking about children, and we talked about the fluoride supplementation. So if we gave tablets, the pharmacist gave a tablet to a patient, or a dentist prescribed a tablet to a potential patient, and we checked the water levels to know what water levels their well water had, would that be as effective? Well, what about the people that are greatest at risk? Would that be people that are challenged financially? I don't know how much it costs to fluoridate water per person. 80 cents maybe a month. Do you think that could be done with a prescription? Or does everybody be able to afford a prescription? I don't know how much it costs for fluoride supplementation by tablet, but for argument's sake, say it was $15. Would everybody be able to afford it? And would everybody comply? I understand personal choice, and personal choice is sort of an issue affected by community water fluoridation, but it's community choice if it's done at the local level. I mean, after all, it's a local water system, and you would have the input that way. But yes, if you're on that water system, you would be getting exposed to fluoride levels that have been shown to be not only safe, but to be effective, and your community would have healthier children potentially, considering there's a 60% reduction in dental decay from that fluoride in the water. I know a lot of people oppose that for many different reasons, personal choice being one, and there's also people that come up with a lot of other reasons that may or may not be true. And we've talked about how you can logically truth test some of these comments. So yeah, I mean, there's options, but they're not as effective. What about having it in a school? I mean, could they administer the tablets to everyone in school? You'd have people that opt out, you'd still have the cost factor, but at least it'd be borne by the school as a public health initiative. They used to have swishing programs in school for topical fluoride and rinse. But of course, this is a different approach. Plus, what about that child that's 4 months old or 1 year old or 2 years old that hasn't made it to school yet, but has those teeth that are going to come in at age 6? They're already developed. It's too late for those kids. But by giving community water fluoridation, we're sure that everybody gets exposed, unless they just happen to be drinking bottled water, which was the question that Chip brought up, and we'll talk about that a little bit more. So we know what's different with the young and the elderly. We talked about the elderly having different types of risks that are handled by topical fluorides much better. And can we find these options affordable, even with the fluoride prescription fluorides that exceed those for people, say, with dry mouth conditions, people that have had cancer and have had radiation therapy and don't produce saliva, if that was in the portal of radiation. What about the dental decay discussion? And there's many seniors, 80, 90 years old, that have lived into their hundreds that I've seen as a dentist for the years, where I basically had to manage the effects of the decay and play this waiting game. Am I going to keep them healthy, or am I going to be focused on cosmetics in that age group? And at what point are they going to run into a biological medical problem? And we're playing the evaluation on in real-time basis there. So can sugarless chewing gum? I mean, there may be times when chewing gum helps if it's sugarless. Think about what sugarless gum does in general. Gum with sugar is going to pump that sugar down into the chewing surfaces of the teeth, into the pits and fissures. You're going to get a lot of decay. You don't want a kid chewing gum with sugar. But sugarless gum, well, it does the opposite. You're chewing the gum, it's pumping that saliva down into the top of the teeth, and it's cleansing the pits. It cuts down on decay. It also stimulates salivary production. So if you have sugarless chewing gum and you're a senior and you can chew gum, you have enough teeth to chew, and it stimulates your salivary production, it's changing the pH and the environment in your mouth. So that could be healthy too. I hate to tell you how many times I've seen individuals that get dry mouth in their senior years pick up sugar mints as a habit. That's sticky sugar mint as it dissolves. It has what we call substantivity, or the ability to stick on the surfaces of teeth. And when it does that, that's what happens with the decay rate. It skyrockets. And when you have crowns that are done, dental crowns, okay, caps, you might say another term for them, artificial coverings for your teeth, that doesn't going to protect what's under the cap. There's still a tooth that it sits on, and that can get decay and be much more susceptible in dry mouth. And many instances, and I teach at the dental school at the University of Florida, we do get a lot of seniors that come in, people with compromised medical conditions. You see these bombed up mouths that becoming impossible to help. So do we have any other questions? I'm going to pause for ID. Whiskey Bravo 5 Delta, Medical Amateur Radio Council, Graham Z. Again, this is a net. We have all those individuals that are checked in our net. We're pausing now for questions from those individuals. And for those of you who are not checked in, check in and ask questions. Make your call to WB5D at this time. The typical during these nets, I would like to think that perhaps the presentation is comprehensive enough, the background information that we guide the net by. So what I do, just from a personal note, is I prepare a PowerPoint ahead of time. I don't talk off the top of my head. I do research. I get all the background. And when I distribute the PowerPoint, which is basically recorded into a YouTube video, the links are not active, but I put links within the PowerPoint, and I make a copy of the slides to distribute to our members of the Medical Amateur Radio Council, and they can truly check out the links. If you're doing it by radio, what I do is describe to you what the links are so you can look them up on the internet. And I hope you find that helpful. I'm always open to discussion and to input on what you think might be better. This is amateur radio, it's public airwaves. We're here because it's our hobby. We enjoy talking on amateur radio. We're not trying to do broadcasting by any means. This is a net. It's a forum. It's a discussion amongst amateur radio operators. We encourage everybody to participate, whether you're a member of the Medical Amateur Radio Council or you're someone with a general or an extra license. You've got a technician license. Hopefully you're listening to our live web stream. We have one that Chip and 5RTF does. It's on marcoaudio.net. marcoaudio.net. He also records that, so you can listen to it later, as well as look for the YouTube channel for Healthcare Hands YouTube channel. But if you have systemic fluorides, those are the ones that we talked about that are ingested and become incorporated into forming tooth structures. And they also provide topical protection because the fluoride's in the saliva, which continually bathes the teeth. But the fluoride can be delivered topically applied to the surface, and that's both through home products, making them more decay resistant. So, why do parents avoid fluoride in the toothpaste for their children? I guess they feel there's potential harm for whatever reason. Maybe they're naturalists, but realize you're going to have the natural progression of decay unless you totally keep sugar out of their refined foods, out of their diet. So there's two sides to any coin. And can children consume too much fluoride from brushing? Bob asked that question in a roundabout way. But his dentist suggested to just spit out the extra fluoride. You'd have to eat the fluoride to have too much. You don't want a child eating the fluoride toothpaste. So what is community water fluoridation? It's the process of adjusting the fluoride content of fluoride deficient water to the recommended level for optimum dental health, which is currently recommended at 0.7 parts a million of fluoride. And it also will work for an area that had too much fluoride, because then the municipal water system can have it reduced to the correct amount that would get rid of the fluorosis or the brown staining on the teeth. So many bottled waters in the market do not contain optimal levels of fluoride. In addition, some types of home water treatment systems, like reverse osmosis and distillation systems, can reduce the fluoride levels in water supplies, potentially decreasing the decay prevention effects of optimally fluoridated water. However, if you're using a carbon charcoal filtration system, they do not remove fluoride. So in my dental office, when I had a practice here in Florida, where you have hurricanes all the time, or you might have breaks in the municipal water supply, we don't want growth in our water lines that feed our dental equipment. And we would put water in there, the bottled water, distilled water. Well, think about what that meant. All of a sudden, there was no chlorine in the water, and your water lines could be susceptible to bacterial growth. So you have to flush those lines. So that's sort of a corollary discussion as to what's happening with fluoride. If you have a water filtration system that takes the fluoride out, then you can have more decay, even if it's a municipal water system. Just like in the dental office, if I take the chlorine out, I can have more bacterial growth, which contrast to what I'm trying to accomplish in my dental operatories. So fluoride supplements can be used to prescribe for children 6 months to 16 years. That's the research range. I think earlier I said 4 months to 18 years of development. They're the ones that are high risk for tooth decay and whose primary drinking water has a low fluoride concentration because they're not on a fluoridated system. They may be on low water. So what about the compliance and the cost? We talked about that. You can do anything and suggest anything as a health provider and professional, but it's got to be accepted. And can school programs be used for either? They can. They could make a difference. Again, you'd have the potential for students being opted out by their parents.
Comment.
Yeah, go ahead with the comment. I think N5RTF would like.
Yeah, this is N5RTF. One of the interesting things about these presentations, I just out of curiosity, I looked up see what the fluoride level was in breast milk, and it's almost 0. So it's same thing with cow's milk. On the other hand, packaged infant formulas, Enfamil and such, do have fluoride in them. And the American Academy of Pediatrics suggests fluoride supplementation for children over 6 months of age. So you know, if you breastfeed, you know, your child is getting almost zero fluoride until such age as they start drinking fluoridated water, or if they switch to commercial formula. N5-RTF.
N5-RTF, Whiskey Bravo 5 Delta. Thank you for researching that in real time, Jeff. That's wonderful information. So now we can understand why the research comment was 6 months to start and not 4 months, because if they're having formula at 4 months, they potentially get too much fluoride. I'm going to turn the microphone over to N3PQ. Go ahead, Munir.
Yes, thank you, Jay. This is N3PQ. I have a question for you. Is there any reliable data about the prevalence of cavities and other dental problems before the modern age? I'm talking about before our modern diet, which, as we know, causes a lot of our ailments nowadays, the way we eat today versus the way we used to eat 100 years ago, 200 years ago. Is there any data that goes back that far? Thank you. This is N3PQ.
That's a great question, N3PQ, Whiskey Bravo 5 Delta. I'm not an expert on that area. We certainly can research that. Refined carbohydrates in the diet and sugar in general. When we think about sugar in times of antiquity, I guess it was a very, very valuable commodity because sugar came by very few ways in antiquity, and probably honey. And as we got into the European years and the modern age, or certainly during the Renaissance, and sugar came from the Caribbean, and they started having sugar cane and realized you could get sugar from beets. You could refine sugar. The diet obviously has changed. We've sort of gotten addicted to sugar. So I guess it would depend which era we're looking at. Archaeological records could probably answer that, but I don't know the answer to that. If those in antiquity had dental decay like we have now, there's certainly plenty of hard tissue that we can look at to study that. And I certainly would think that it's possible to have looked at it century by century if you're willing to look at skeletons. So I think that's a very doable answer, but as to whether or not it's been done, Munir, I do not know. Any follow-up comment to that? N3PQ, Whiskey Bravo 5 Delta.
Yeah, this is N3PQ. Yes, thank you. Also, actually a follow-up is another question. I think you might have touched on this. I'm not sure if I saw that. I know people in their 80s and 90s. I have known people in their 80s and 90s with not a single tooth decay. How strong is the genetic element in this? How strong is that?
Yes, that's another wonderful discussion and question. Yes, so obviously there's genetic differences. For the strength of it, I don't know. I mean, I'm one of those individuals that has a very low decay rate. Why? Is it just genetics? And why, if it was genetics, why would it be the case? Is it the actual structure of the enamel that's less likely to decay? Or do some individuals have a different acidity level in their mouth? We know people do. And then because of that, maybe the bacteria can't do the same effects. So the interesting comment, I'll tell you a little story about the University of Florida and researchers, because I used to write quite a bit for journals. And back in the late 1990s, there was a researcher at the University of Florida, and he actually did research and was able to have a genetically modified form of strep mutans that did not, the bacteria that causes dental decay did not produce acid. And because of that, the potential to solve the problem of dental decay existed. But as we all know, anything that was genetically modified during that time was certainly not popular with the public. In addition, if you had introduced that into somebody's mouth to decrease dental decay, they would kiss somebody and give it to the next person. And there would be a wide legal issue there. So it never went any further, even though scientifically it was doable. So genetics can play a big issue, but there are ways in nature. And I think he actually started that through looking at different strains of that particular bacteria for ones that didn't produce acid. And once he did, the gene splicing he did was not to allow them to produce less acid. It was allow them to compete for the oral environment more successfully, so they would be the predominant species in someone's mouth. So, yeah, there's a genetic component, I'm sure. As to the extent of it, I do not know. There's certainly people that don't take care of their teeth and don't get gum disease either, even though they have bacteria and plaque all over their teeth. If you're one of those individuals that's fortunate enough, that's wonderful. But we did say earlier, Manir, when we were talking about the percentages of fluoride, that 60% reduction in decay. So perhaps that other 40% were people that were already, genetically not prone to decay. It's possible. I don't know that as a fact, and that's something that's a whole other discussion thread. As we said earlier, having these discussions on the air opens up whole new ways of looking at topics and their questions to be answered. But thank you very much, Manir, for the excellent input. This is Whiskey Bravo 5 Delta from the Medical Amateur Radio Council. Grand rounds of the air. Do we have any other questions here on 20 meters? Make your call to WB5D. So there's a few other factors here. No questions heard. We're just about done here with it for the day. We appreciate all amateurs allowing us to have the use of the frequency. Often we have individuals at Parks in the Air that uses frequency range, so we're certainly very appreciative that our long-standing net is allowed to continue on. So while topical fluoride strengthened teeth already present in the mouth, making them more decay resistant potentially, are they equally effective for all individuals? And getting back to Robert WR8BT's question. So Robert, what if our pH in our particular mouth is not the same as the intended product to be used at? Would it be more effective or less effective for different people? I would think so. That might even be true of prescription levels of fluoride. And there's different types of topical fluorides, not just one formulation. What about seniors that wear removable prostheses? What if you're wearing a removable partial? Does that add to the risk? Are you taking that partial out and rinsing your teeth and brushing after every meal? Do you wear it all day long? I mean, what is a removable partial? It sits on the teeth. And if you have food and debris, it's going to get under that partial. And it will sit there all day long if you don't take it out. So does that add to the risk? What I would do for patients that were at risk, I would prescribe a prescription fluoride for them to brush before they insert their partial in the day. That way they would at least have a little bit of protection. That was my personal approach to removable prosthetics. Systemic fluorides also produce that topical protection because fluoride is present in saliva, which continually bathes the teeth, but it's more the topical that will give us the benefit where that hydroxyapatite that sort of was lost at the surface can be supercharged to avoid the dissolution. It's already been started by acid replaced by the fluoride. And self-applied topical fluorides include toothpastes, mouth rinses, and gels, but they can also be over the counter by prescription. And when kids go to the dentist and have their teeth cleaned, while their teeth are clean, a professional applied topical fluoride gives the higher strength rinses and gels and foams and fluoride varnishes that are painted on teeth can incorporate into the enamel because it's clean. I mean, if you're using a fluoride at home, do you put it on dirty teeth or do you put it on clean teeth? When you brush your teeth, obviously you're cleaning your teeth. That's just the level of fluoride in an over-the-counter toothpaste. So if you're going to use a supercharged product that's prescribed to you, make sure you're doing it on clean teeth, brush and floss, and rinse real well first, then apply it. Well, that's the last of the points that I had wanted to make. And I certainly would love to answer questions. So I'm going to open up the floor to any follow-up questions. Make your call to WB5D. Manir, N3PQ, I'm going to go ahead and hand the mic over to you.
Yeah, this is N3PQ, Munir. Forgive me, Jay, if I missed this point. How did they determine initially how much fluoride to put in the water? In other words, too much would produce fluorosis. How about have they done a study to see what's the least amount they can put in the water that protect the teeth and maybe not be so concerning for long-term side effects, including neurotoxic side effects?
Yeah, great question, Manir. I would imagine, I can't cite the study, but from what I remember, in my education, that 0.7 ppm that's used as the target amount took that into account. So you'd have individuals that don't drink enough water, but you'd also have individuals that drink more water. So that would have been in the therapeutic index of the fluoride. But what you wouldn't account for is fluoride that you get from another source, because there are wells that already had that amount of fluoride. So you wouldn't want somebody using a tablet if they already had it, because then you'd be outside of the index. As to toxicity, from a neurological standpoint, I don't know what level that starts to occur. But I'd imagine that they would have not selected that, and they would have done studies for that. As to the exact studies and the chronology of the studies, that I don't know. The study that was showing the decrease in range in Grand Rapids, we talked about that earlier in the I believe in the 1950s, 1940s. But I'm sure there's been many, many more studies. So the question, if you're a doubter or concerned about that, would be to try to find a study that answers the question in a scientific way that's truly based and from a reliable source. But there's no, when patients would come to me and ask a question, there is no fault in asking a question. The question needs to have an answer found for it. And just make sure if you're doing the research yourself, that it's being from reliable sources and not just, arguments and comments that are made that don't have any true foundations other than emotional foundations. Does that answer your question, Manir? Go ahead.
It does. Thank you, Jay. And I also have one last comment. I think we're going to have a natural study going on. The states that will decide not to have fluoride in the water, if a study can be done over 5, 10, 15, 20 years, and then we can see, okay, the effect on cavities, we can see the effect on the brain, the concerns about autism, ADHD, the effect on mitochondria. I mean, this would be a natural study that we don't even have to, we're going to have natural controls here. So this should be interesting. Thank you.
Yeah, and that brings up another thought here, Manir, N3PQ, Whiskey Bravo 5 Delta, AA4, well, Mike. There are already groups of individuals that are on well water that have, fluoride. So the question is, if knowing what their fluoride is, if it's in that fluorosis range, do those problems already exist in those groups? So you don't even have to wait 5 years. They're there. I mean, how they got the fluoride, whether or not supplementation, lack of supplementation is actually immaterial in a study like that. The question is, what is the level in their drinking water? So you might find that those studies have existed. Again, I'm not a public health, I'm not a PhD in that field, certainly not an expert. I'm giving you observational information. I'm also basing some of the comments they make on research as well as the personal experience. Thank you for opening up that avenue of thought. They're excellent questions. Any further questions? Make your call to Whiskey Bravo 5 Delta. WJ8B, I'm going to turn the microphone over to you, Andy.
Okay, well, part of the thing I don't think anybody brought up is that, why are people concerned about this? I mean, there's some concern about autism being caused by, fluoride. And of course, our definition of autism in the 2025 is quite different than what it was, say, in 1950. Which is getting into the range of my birth date, et cetera. And I don't know how they would ever correlate that data, knowing that fact. But I think anybody that has to say that needs to keep that factor in mind. And that's, I don't know how that's going to happen. It would be a shame to have a very small incidence of very minor autism for, quit using fluoride completely and have lots of people have dental caries as well as other serious medical complications from that. So back to you, Jay.
Thank you very much, WJ8B, Whiskey Bravo 5 Delta. Excellent comments, Andy. And you would think we could answer that question similarly if there was a desire to, because we do have groups of individuals and we know what level of fluoride they are in a particular region, if there was a will and a way. we're in a political environment right now that I'm not sure there would be funding for that, but it's certainly a question that's worth investigating and finding an answer for. And because as to what causes autism, we know that it's certainly measured much higher levels today by today's day and standard than it wasn't before. So yes, it's important to try to find out if there's a reason for it or it's just we're cognizant of it. And you had mentioned different levels of autism as well. I'm not an expert in that field. It's certainly a discussion on autism for someone that is to come in and lead a forum on that of the Grand Auxiliary. Excellent comments. Any other questions? Make your call to WB5D. Well, thank you for everyone that's participated and for allowing us the use of the amateur radio frequencies to have this net in this forum, this interactive discussion, it's roundtable discussion as nets are. And we will be signing off and allowing the frequency to return to general amateur use. Everybody watched national championship game on Monday night. I'll be cheering for my Gators. And of course, we're playing Houston, and there's some of our members that live in the Houston area, including one particular flight surgeon who works for NASA. So I hope we ground NASA and that we take off. But you know where my mind will be. Now you know why the ether's running late. There's too much basketball in my life to focus enough to focus on the newsletter. It should be out in the next week. 7-3 all. I'm going to go ahead and stop recording here. It's being made for YouTube.